The constant pain from neuropathy, it is so difficult to deal with, but there may be hope for you out there to find relief. This is Dr. Patrick Sartz of Neuropathy Treatment Center of Arizona with how he is able to help you. And Dr. Sartz, you've been doing this a long time. You've been researching the symptoms. You've been looking at treatments. What is peripheral neuropathy?
Well, peripheral neuropathy is a secondary disease process. There's over 100 known causes that basically cause a loss of oxygen to the ends of the nerves at the skin level, and the cells at the ends of the nerves actually start to die off and go deeper into the tissue. They'll start to fire indiscriminately, causing numbness, tingling, burning, cold sensations, pain. It also starts to affect the balance because the nerves are no longer down at the sole of the feet. They're actually deeper into the tissue, so people may feel like they're walking on a sponge or a piece of cardboard.
And you said a lot of times patients come to you and they're told, hey, there's really nothing you can do, that nerve is dead. You disagree.
Well, think of it this way. If the nerve was truly dead, they wouldn't have any sensation. There wouldn't be any numbness. There wouldn't be any pain. The nerve's not dead. It's the cells at the ends of the nerves that are actually dead. And there are things that we can do to actually stimulate the regeneration of those nerves. There's over 21 studies that have been published in neurological journals throughout the years that show that we can actually reverse the neuropathy symptoms by at least a 60% and increase balance by at least 80%.
How does the nerve become damaged to begin with?
Well, basically, it's a loss of oxygen.
Okay.
Either the transport system or the transfer system. And I'm going to use diabetes as an example because it basically takes in both things. When someone's blood sugar is high, the sugar's not just floating freely through the bloodstream, it's transported on the red blood cell at the same point that oxygen should be. A hemoglobin A1C, which is a test that they test for, when that percentage goes up, the oxygen levels actually go down a corresponding amount. And it's that loss of oxygen that actually causes damage to the cells of the nerve. But it doesn't just cause damage to the nerves themselves, also the other tissues, primarily the capillaries, where we actually have the exchange of oxygen and nutrients from the bloodstream to those tissues. And this is the reason that someone can maybe get their diabetes under control for years, but when it was high, it damaged the capillaries, and so they'll develop neuropathy years after they've had their diabetes controlled.
So can it be cured? Can neuropathy be cured?
No, but it can be treated.
Okay.
But it is a constant treatment, and that's the problem. Once you've developed neuropathy, you're prone to have it again. So people will go in, there's no medication on the market that'll even stop the progression of it, that will mask the symptoms. But there are treatments that can reverse the neuropathy. The thing is it needs to be going on for the rest of their life, because if they don't, the neuropathy will come back. And so our treatment protocols address that and allow people so that they can reverse the neuropathy and then maintain it.
And they can do this at home, so you'll teach them how to do this at home.
That is correct.
And this is a personal journey for you. You opened this center because you watched your mom go through this.
Right. My mom developed neuropathy when I was about 12 years old, so I had the opportunity, unfortunately, to watch the progression. My mom spent the last 16 years of her life in a wheelchair. And basically, it altered my parents' retirement dramatically.
And you said this is a personal journey because you don't want anyone else to have to suffer like this.
No, and there is things that can be done. And unfortunately, a lot of times they're told there isn't, but that is not true.
And you said that the treatments that you use, you're using infrared therapy, what else?
We actually use infrared. We use some electrotherapy that's actually used by the Cancer Treatment Centers of America for chemo-induced neuropathy. And it's a combination of also some things nutritionally, Nobel Prize winning things that we found will actually allow the regeneration of these particular nerves.
And get back to life.
Yeah.
Thank you so much. We appreciate you. Let's give you a special offer from Neuropathy Treatment Center of Arizona. They do have a special offer for the first 20 callers. You will receive a free neuropathy consultation. They are located at 2150 South Country Club Drive, Suite 14 in Mesa. Call 480-556-1358 or go to freeneuropathyconsultation.com.